Hi, everyone. My name is Mary Connor. I'm Senior Manager for Early Intervention and Prevention. I feel like I need to get everyone to get up and do some star jumps. It's so cold in here. Forgive me if the rain starts. I'll try and speak up so that people can still hear. Elizabeth and Alison had asked me to come along today really just to explain what my role is and what we're doing in Northumberland in relation to early intervention and prevention services. I suppose some of you might have heard that phrase kind of used a bit in relation to your children, in relation to children's services. Early help, again, is something that's sort of quite in vogue with government speak at the moment. So it's just really to explain a little bit about what we're doing in Northumberland and I guess how it links in with some of the things that Jane was talking about in her presentation. So just to give a little bit of background first of all, my role was established in April 2013, I think, as a recognition that Northumberland wanted to try and pull together all the different services who potentially could offer early intervention and prevention to children and young people and families in Northumberland. I've actually only been in post since October, so it's taken a little bit longer to get things going than I think was originally envisaged. But I think it's really important to say that this isn't just, I suppose, a local authority agenda. It's a multi-agency agenda, which is why I'm using the kind of the local safeguarding board template, because the local safeguarding board, for those of you who don't know, is the sort of multi-agency kind of forum where agencies come together and talk about how the best ways to protect children. And one of the best ways to protect children at the very early stages and to make sure that they're getting their needs met is to provide early intervention services. Okay. I really like this quote because I think it's really important in getting people to understand about how long early intervention, the impact of early intervention can take. And I think this is one of the reasons why in the past we probably haven't done it very well. I think generally as agencies, people have been provided reactive services because they get you, I suppose, your quick wins. Early intervention isn't a quick win. You might not see the impact of it for 1 or 2 generations. But over the last probably 10 years, there's been a huge amount of research about the impact, particularly on children's early development and the impact that that has then on their long-term outcomes. And we've obviously got a picture of a baby. I notice we've got a baby here somewhere today. And we know so much more about babies' early brain development now, that we know that those first 3 years of life are absolutely crucial to how they then develop into young people and into adults. And we want to, wherever possible, provide support at that stage, but also at any stage in which a young person presents with needs.
Why is it so hard to get into the system then, before that age? Sorry, I'm just picking on a place that it's so hard to get into the system, the child at that age, to actually get anybody to take notice and to take notice.
And that's one of the things. I'm standing here saying we know we've not got it right as things stand, and that's part of my job is to try and get it so that it's better for yourselves, so that you're not sat here. I'm hoping that in 3 years' time, I'm not stood here with parents still frustrated because their 3-year-old's not in the system.
It's fantastic in 3 years' time.
I know, and I absolutely understand that for you, you're feeling a level of frustration, and that's really important to hear, because that kind of makes it all the more important that we need to get things right for the future. But if you want to talk to me afterwards about how what we can do, then that's absolutely fine. But I'm standing here acknowledging that what we're wanting to do is make things better for people in the future, and that we haven't always got it right in the past. Okay. So in terms of just a definition, this is sort of the definition that's in Northumberland's kind of draft early help strategy, and it's, I think, early intervention and prevention are words that are kind of bandied around, but people don't necessarily know what they stand for. For us, preventative services are those which any child could access. They might not need to, but they might. So it includes things like health visiting services, immunisations of children, low-level support that's provided at school. So it might be, an extra reading group. Not all children would need that, but they're available universally for children who do. Early intervention is really, I suppose, the next step up for that. So it's about that very early stage when a child might present with a bit of a concern, a bit of an issue, and it might be school, it might be nursery, it might be a parent who says, I'm not happy about how things are going, I'm not happy, there's something not quite right really here, we're a little bit worried. And it might be that something very straightforward can be put in to support that child. It might just be saying to one other agency, can you come and just give a bit of support? But it might be that actually it needs to be a bit more coordinated than that. And at the moment, it could currently be provided through a CAF, a Common Assessment Framework, which some of you may have heard of. And that might include, things like low-level support from the LIST team, or it might include an intervention from the school nursing service, but it might include a more complex package for children who don't quite hit that, I suppose, statutory framework, so they don't sort of really need all those really, really specialist services, but there's enough concern that there's a few people involved and you need to coordinate a package. Okay. And we know at the moment that that's the bit that probably isn't working as well as it could be. And that's the bit that we need to get right. So my sort of key actions in the first 6 months of my post really have been to sort of develop an early help strategy, and I'll talk a little bit about each of these, to develop an early help assessment, and to start looking at what the early help offer is in Northumberland for all children. And I have to stress, we're talking about all children here across Northumberland, not just children with SEN or disabilities. This is for all children. Okay, so in terms of the early help strategy, the early help strategy is it's a multi-agency strategy that's overarching, that sets out Northumberland's vision for early help. And it's currently in draft format. It's going to be signed off by various different multi-agency groups in the next few weeks, and then it will be on the Northumberland website. And we've established an area on the website that is called Early Help Services, so people can go in and you can go in and you can have a look and see what's there, and we'll build that up over the next few months. And it's really important that we have that strategy, because that's the sign up by all the agencies to say that they believe in what we're doing and that their agency is brought into that, and we can hold people to account to that. So it's really clear that it's not just a local authority thing, it's not just a health thing, it's not just an education thing, it's everybody involved in Northumberland. The early help assessment, again, some of you might have had experience of a CAF or heard of a CAF in the past, Common Assessment Framework, and really the early help assessment is building on the principles of that. So we're not kind of chucking out everything that was good about the CAF. What we're trying to do is build on what worked with that, but I suppose learn from some of the things that people said they didn't like about that, some of the things families said they didn't like about that, to try and make it better, really. We're working really hard with Jane here, Jane Allison, people who've been involved with the Education Healthcare Plan development, and also the single social work assessment, which is also being developed at the same time, to make sure that this fits in with other plans, because what we're really keen to do is make sure that they feed into one another. Our aspiration is families should only have to tell the story once, because we know that that's what families have been saying for years and years, and that what we want is that if families have an early help assessment and then it happens that they need to go on and have an education, health and care plan, that the information from the early help assessment will help inform that plan, and that there'll be information there that all the professionals who are kind of making decisions and looking at it will be able to have access to. We've worked with sort of various groups in developing this, and I think one of the things that came up was that really we wanted a family approach. So in the past, CAFs have been very much about a single child, and actually children don't operate singly, they operate within families. Yes, they may have their own individual needs, but how those needs impact them is very much to do with their family life, their environment, and we need to acknowledge that. We also need to acknowledge that children's needs have an impact on the rest of their family, including their siblings, and it may well be that they need some support as well. Okay. As I said, this is being presented at the Safeguarding Board and at the Family and Children Trust Board, which are both the multi-agency boards that sign this off, and they're going there one this afternoon and over the next few weeks. We're also having locality events next week in each of the 4 localities to launch this with a whole range of professionals. We're really keen to make sure that people buy into this, because this is only going to work if all the different professionals in all the different agencies understand the importance of this. And that's kind of part of my job, is to go around and say that, because what we want to do is make sure that families have an opportunity to have a coordinated, joined up plan at the first point that needs arise, and that they're not saying 5 years down the line, but I wish I'd had help the first time I'd asked for it. And we've also got a training programme that's going to be available to practitioners. So we've trained 31 people last week from a range of different agencies who are going to then go back to those different agencies and provide training for them. Okay. And this is just a delightful diagram, courtesy of my colleague Jane over here, to try and, I suppose, explain to you how things fit together. So the easiest way to do this is come over and do it like this. Okay, so we've got the 3 different drivers in terms of education, social care and health, in terms of the statutory guidance. And they kind of lead up to the different stages of a plan. At the very top, we've got the education, health and care plan for the children who are the most complex. But underneath that, we've got the different elements that are singly kind of provided by each agency. The early help assessment plan, as you'll see, sits underneath that, and that's about trying to coordinate it in the same way that the education, health and care plan will, but at a much lower level. So I hope that makes sense to people. I'm happy to try and explain it better if you need me to. The early help offer, because one of the things that I've had a lot of questions about when I've been going around schools and various different groups is, how does the early help offer and the local offer, how do they fit together? Are they the same thing? Are they different? What's my child entitled to? Schools saying, well, how do they kind of all fit together? Which one do I fit into? So I thought, well, I'll try and do a little bit of an explanation of that. So in terms of the early help offer, that's about providing support the first time a family or young person needs help. And that might be them shouting help, that might be them presenting in different ways where, like I said before, there's just some concerns. This definition up here again is from the early help strategy, but it's a widely used phrase. I'll show you a quote in a minute from Working Together to Safeguard Children, but also various other publications. It's widely used about that, trying to prevent children needing to escalate into more specialist services. Okay, so in terms of early help, what we're doing currently, it's fairly early days in terms of the actual offer, but we're working with a couple of school partnerships quite closely, Blythe and Berwick particularly, to look at what's on offer in those local areas. And that's because those school partnerships approached me and my manager and said, we want to do things differently for children and young people in our area. So we're currently working with both of those partnerships to look at how we can deliver services at an earlier stage better for children. One of those things that we're going to be doing is piloting a locality hub approach, which is basically about referrals coming to a single point in that area. So that would be all referrals for children who have any additional concerns would come in, and there would be a kind of multi-agency hub who would look at those and would decide the best course of action. And that's about trying to coordinate an approach really and get people talking to each other and get people to be held accountable for each other's actions and for their own actions in that multi-agency group. We're looking at some specific areas. So one of the things that came up very early on when I was in post was lots of people were saying, oh, we have this issue about children being school ready when it comes to communication. That was something that came out from lots of different school partnerships. So what we've established, and it's very early days, is a sort of a strategic group that's looking at sort of that early pathway around language and what we need to have as a Northumberland model. Because what we've got at the moment is lots of people doing really great stuff in their areas, responding to local need, but not a kind of a consistent, coordinated approach to that. So we're going to try and join that up. That'll take time because it's a massive piece of work, and we're at the very beginning of that, but there's an aspiration to try and have a Northumberland model for all children. And we're starting to look at redesigning some of the services, and again, this is a sort of a medium-term approach to look at how we can move down some of the resources that we've currently got that are only available to children where there are real, when they kind of hit child protection thresholds or where there's really serious concerns, how we can move some of those resources to much earlier to try and prevent them needing to get there. Okay, so this is just a quote from Working Together, just checking how I'm doing for time, Working Together, which sort of sets out kind of the definition of the early help offer, which I think is sort of fairly clear, really. And then we've talked about the local offer in Jane's speech, but this is the definition taken from the Children and Families Act, which is very comprehensive. But the local offer is basically any service at any level for disabled children or children with SEN, as opposed to the early help offer is about lower level services for all children, including children with SEN and disabled children. And I've tried to produce, now I'm very excited about this diagram, because it took me ages to kind of try and figure out how we might have a diagram that sort of showed. It looks a bit like a lollipop, that's the only thing. It reminds me a bit of a rocket. But it was just to try and demonstrate really where the overlap is between the local offer and the offer for the local offer for disabled children and children with SEN. So again, you've obviously got your early help offer that goes across universal and kind of that lower level targeted services. And then you've got your local offer that comes down, which can be for any child with SEN, but it can go at any level. So it can be for the most complex services, specialist services, but there can be a real overlap as well. And obviously our aim is to try and provide as many services at that lower level for as many children as we possibly can. Okay, that was everything for me. Has anybody got any questions?
Just one quickly, will that reduce are you able to reduce the time it takes to be seen? Because I know we're given a minimum wait of 18 weeks to see it sits, for example.
Right.
So is that going to reduce the time that you're in before anything actually gets done? Do you know what I mean? Yeah.
I mean, I know that there are lots of issues to do with waiting times around particular services, and yes, that is part of our aspiration. At the moment, I guess I'm working on the bit that I've got control of, which is the bit within the council, and then what we're doing is talking to partners. What we'll be doing as things go on is filtering stuff down and pulling those people in and saying, actually, how can we do this differently? And we are starting to have those conversations with people like SIPS about, well, okay, if your waiting time's that long, what could we be doing in the meantime? What training, what resources could you provide to people to be helping to support those children in the meantime? We're not there yet, but those are the kind of conversations that we're starting to have.